With the diversity of new COVID-19 variants, infections can happen rapidly and sporadically. If you are worried about being infected, the 𝗧𝗦𝗂𝗓 COVID-19 Rapid Antigen Test Kit enables self-testing of COVID-19 antigen to be done at home. Only get test kits that are approved by the Ministry of Health Malaysia. Do not eat, drink, chew, or smoke for at least 30 minutes before the test. Clean the test area and wash your hands thoroughly with soap and warm water. Then follow these easy steps. Check the test kit, including the expiration date. The complete test kit contains 5 components, including test kit in foil bag, extraction buffer tube and dropper, disposable swab in sterile packaging, disposable waste bag, and user manual. Remove the extraction buffer tube. Press and insert the tube into the tube holder provided on the top of the box. Remove the aluminium foil on the tube. Do not spill the liquid in it. Remove a swab from the sterile package and avoid touching the end of the swab's fabric. Swab the fabric tip on the inside of your left cheek, which is the area between the cheek and the gums. Rub it up and down 5 times. With the same swab, repeat this step on the right cheek and then rubbing left and right on the palate of your mouth 5 times. Make sure the fabric tip of the swab does not touch the tongue, teeth, and gums. Fasten the dropper cap tube tightly. Insert the end of the swab gently into one of your nasal cavities, about 2 centimeters deep. After that, rotate the swab around the inner wall of the anterior nasal and make 5 complete rotations. Then, repeat the same step on the other side of the nose. Do not insert the swab too deep. Thoroughly soak both swab tips in the buffer and stir for at least 10 times. Squeeze the liquid from both swabs to gather as much of the solution as possible in the tube. Discard the used swabs into the supplied waste bag and zip the bag securely. Fasten the dropper cap tube tightly, tape the tube, and mix the sample solution thoroughly. Tests should be performed immediately once your sample is collected. Gently tear the foil pouch and remove the test kit. Place the test kit on a clean, flat surface. Add 2 drops of the sample solution into the sample well. Make sure there are no air bubbles. The sample will start to absorb up the membrane. Check the test results within 10 to 15 minutes. If the result is negative, a single colored line on the control line C will appear. Despite a negative result, make sure you continue to practice physical distancing, wash your hands regularly, and wear a face mask. When a test result from a 𝗧𝗦𝗂𝗓 kit shows you are positive for COVID-19, immediately seek advice from a medical professional at either a private health facility, the COVID-19 Assessment Center (CAC), or a nearby clinic. Additional examinations such as RT-PCR testing may be needed to confirm your results. The test result is considered invalid when no control line C is visible, and you must repeat the test using a new kit. Put the used test cassette and buffer tube into the waste bag provided and seal the zipper completely. Keep all of the used test kit contents in a sealed plastic bag. Tie it tightly and throw it in the trash. Thoroughly wash your hands again with soap and warm water. Get 𝗧𝗦𝗂𝗓 now. Together, we can end the COVID-19 outbreak. Test yourself. Protect the community.